Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Diuretics. Diuretics are the drugs which cause net loss of sodium and water in the urine. And in the diuretics, these diuretics will cause loss of sodium and water in the urine, and thus these are used in conditions where there is excess of water in the body, like different types of edemas and sodium retention in the body. In such cases, we can use these diuretics. So, classification of diuretics. Diuretics are classified as, first we have high efficacy diuretics are also called as loop diuretics. We have high efficacy diuretics or loop diuretics. These will mainly inhibit the sodium and potassium and 2 chloride transport. So these will inhibit the sodium, potassium and 2 chloride transport. So high efficacy diuretics or loop diuretics mainly include furosemide, we have bumetanide, and then we have torsemide or axosemide, or we have ethacrynic acid. So all these are the loop diuretics. Then we also have one more type of diuretics, which are medium efficacy diuretics. Medium efficacy diuretics are of two types. So when we have these medium efficacy diuretics will inhibit sodium chloride symporters, and these are actually thiazide diuretics. The thiazide diuretics include hydrochlorothiazide. We have hydrochlorothiazide, then benzothiazide, then we have hydroflumethiazide, and clopamide are the thiazide diuretics. Then we also have thiazide like diuretics like chlorthalidone. Then we have metalazone. Then we have xipamide and indapamide are the thiazide like diuretics. Then we also have weak or adjunctive diuretics. In the weak or adjunctive diuretics, we have carbonic anhydrase inhibitors. These include carbonic anhydrase inhibitors like we have acetazolamide, then we have methazolamide, and we have dichlorphenamide. Then we also have potassium sparing diuretics are present. So these potassium sparing diuretics include, actually these potassium sparing diuretics are of two types. One, we have aldosterone antagonists, and we also these aldosterone antagonists are spironolactone, eplerenone we have, then we have candrenone. And the second type is we also have inhibitors of renal epithelial sodium channels. There are inhibitors of renal epithelial sodium channels are present. These renal epithelium sodium channels are triamterene and amiloride are the inhibitors of renal epithelial sodium channels. Then the other drugs which are weak diuretics are, we have osmotic diuretics are present. These are also called as aquaretics. These include mainly we have mannitol or we have isosorbide dinitrate, or we can use glycerol, or we can use urea also, are the osmotic diuretics. Then we have adenosine. Adenosine antagonist, that is A1 antagonist is present. Adenosine A1 antagonist is actually a caffeine, is an adenosine A1 antagonist. Then we have ADH antagonists are also present. These ADH antagonists are actually conivaptan and also tolvaptan.
thank you and thank you for watching.